welcome. I hope you're having a great meeting. I'm really happy to be here. It was actually, I took this writing course recently at my local hospital, and it was one of those announcement emails that you sort of hit the delete button as fast as you can, and then you go back to delete and resend it to yourself and let it sit there for a while. And I remember saying to myself, Scott, you've been trying to write this book on healthcare forever. Do something different and go to the course. And I did, and it was really, really enjoyable and fun. It was probably week 5. I remember I put my hand up and I asked the creative writing professor, I said, why do people write? I was really trying to figure out myself. Why am I spending so much of my valuable time trying to write this book on healthcare, and I got a lot of things on my plate? Well, I'll take his words to my grave. They were just crystal clear. He said, Scott, people write because there's something they just have to say. And he just repeated it. And it was a wow moment. The words just spoke so loudly to me. Well, ladies and gentlemen, I'm up here today because there's something I just have to say. And I truly thank Neil Shore and LUGPA for giving me this opportunity. And what I have to say is that I believe we have a healthcare crisis, and the crisis is now. Costs soaring out of control, threatening the financial health of individuals, but of our nation. Quality deteriorating in spite of world-class care signs in nearly every corner. Physicians checking out and burning out. And I do believe it represents one of the greatest societal issues of our moment, actually. I believe that. We're going to talk about cost, we're going to talk about quality, we're going to talk about burnout, we're going to address solutions and survival tactics, but those two simple words, be different, actually, I believe is a solution to the problem. I'm going to be asking you to be different, and we'll come back to that in a little bit. Now, I've given this a lot of thought, and I said, you know, if I'm going to get up here and give you such an opinionated, passionate talk on healthcare, I think it's important to know what I believe, because my beliefs, you know, our beliefs shape our, our words and our thoughts, and my beliefs may be very different from yours. Well, I was sitting poolside a couple of years ago in Lindsay, my daughter's spring break in South Florida in Fort Lauderdale, and I wrote the following words and some of the ideas I'll share with you today. I believe a great nation is a healthy nation. I believe that. I believe in a great nation, every living soul should go to bed at night knowing they have access to affordable health care. I believe that. I believe in a great nation, the brightest and best young men and women should yearn, and I mean yearn, to be healthcare providers like I did when I grew up in Eastern Canada. And I believe, and this is really important, that in a great nation, excellence is more important than profit, especially when it comes to healthcare. And unfortunately, I believe we have a healthcare crisis, and the crisis is now. You know, we spend more in healthcare than any other nation in the world. We're spending about $10,000 per person per year, and that number is climbing rapidly. But in the greatest country in the world that spends the most on healthcare, so many people can't afford healthcare. I don't mean just the uninsured. So many people with insurance in this country can't afford their healthcare. In the greatest country in the world that spends the most on healthcare, so many employers can't afford to provide healthcare. They can't afford healthcare. They're having difficulty as a small business providing it. And in the greatest country in the world that spends the most on health care, the government can't afford health care. Medicare and Medicaid is going broke. So let me get this straight. In the greatest country in the world that spends the most on health care, the patients don't have it, and the employers don't have it in an employer-based model, and the government doesn't have it. Well, who's got the money? I mean, Jerry Maguire, let's ask him. Well, I'll show you who's got the money. Corporatized health care has got the money. What I refer to as the Wall Street of medicine. The makers of drugs and equipment, the hospitals, the third-party payers, the litigation and regulatory attorneys, and they lobby to the White House every year for fertile soil, hopefully to ensure up to double-digit profit margins. Now, I just want to stop for a moment. I'm a capitalist. I actually support these folks, and I have relationships with them. I actually thank them for bringing us the best system in the world. But the corporatization has gone too far. And it's gone too far because the carnage is real. And the carnage is real because even though Wall Street in medicine is doing well, Main Street, the doctor, the nurse, and the patient is getting hammered. And that's just a fact. If you think about it, of these deductibles of, let me just say, deductibles of $5,000 to $10,000 a year, that reset every January, is a rigged system. If you have premiums greater than home mortgages, that's a crisis. I sort of jokingly think I'm right when I say the doctor, patient, and nurse now exist in this country so a whole bunch of people can make a whole bunch of money. And unfortunately, this is very important. This is going to have generational consequences. Because when you spend more and more of your money on health care of your disposable income, you have less money for other things like food, and you have less money for healthy food. And less money for healthy food in our great nation is going to have generational consequences. And if you're spending all your money on health care and you're not saving for your kids' education, less money in this nation for your kids' education is going to have generational consequences. And if you have less money for your retirement because you're spending on health care, who's going to look after you when you're retired? This is going to have generational consequences. And unfortunately, it really surprises me is how silent the country is. A country that goes berserk if the price of gas goes up 50 cents. But if you really think a substantive conversation on this, you really don't hear it. And I think actually that's the problem. Now, unfortunately, in spite of all that money, we're not getting what we pay for. I think there's been a tremendous dumbing down to the American health care that I've seen here in the last decade. I've been here over 20 years. And I think, let's face it, the white cap days of nursing are over. I do believe that a lot of the nursing care in this country is unacceptable. I believe that. We are multiplying nurse practitioners and PAs like rabbits. And hear me, they're a very important part of our healthcare system. But multiplying them like rabbits and staffing urgent cares and ERs all over this country and driving people through these profit centers is not excellence. In spite of world-class care signs on every corner, hospitals every day sacrifice excellence for profit. That's just a fact. And finally, I do not want to be demeaning or rude, but I think the B team of physicians is coming, and in many cases, they're already here. Excuse me. Now, cost problem, quality problem. We're not getting what we pay for. My Southern Belle wife, Andrea, would rarely curse. So what would she say? She'd go, Jiminy Cricket. In a country that spends the most on healthcare, what the heck happened? Well, let me explain to you. The body of healthcare is like the human body. And it has 7 systems or organs. Okay? And the whole health of the body and each organ or system, the health of it is codependent on the other. In the case of healthcare, the 7 systems are the 4 players of corporatized healthcare. That's 4, the patients, the providers, and the government. And each system has been infected. It's been infected with a deadly virus. In fact, it's been infected with the greed or entitlement virus. Let's face it, most of us are pretty guilty of this. Most of us have been taking as much as we can, as fast as we can, and the system is exploding. It's just the way it is now. Now, and what happens, and I want to rephrase it, is we've commoditized healthcare in this country. And when you commoditize healthcare, let me rephrase it. When you Walmart medicine, you know what you get? You get Walmart. You get highly functional, good and very good, but in my opinion, not enough excellence. I'm not an expert on this, but I think people corporatize and get really big because through economy of scales, through negotiating strength, through all these other processes, you drive up profits to the corporation, but the corporation often doesn't share it with the end user. In fact, they usually get less. In this case, that's the patient, the doctor, and the nurse. It's a problem. And just like we did for education, let's go back a slide, which we clearly commoditized in the early 90s when I was at Duke. I said, man, they made this a commodity. And what you've ended up with education, like education, it's way too expensive. The access to most is limited. The quality is deteriorating. The provider is devalued and disrespected, and you're not getting what you pay for. And now we're doing the same thing to education, and that's a societal problem, or the healthcare. Now, I stand before you today to proclaim the following. The death blow to the American healthcare system and how it's going to adversely affect this great nation is the devaluation, the commoditization, and the gutting of the profession of medicine. Because when the profession of medicine dies, you die. When the doctors in this room die, you die. And I say that because the doctors are the bridge. They're the bridge, the multi-million-dollar profits for hospitals and safe surgery. They're the bridge, the cost-effective medicine, hoping to drop your copay or your deductible, etc. We're the bridge to using all the new goodies and tests and equipment that are quite expensive, actually. But most importantly, we're the bridge to compassion, loving, and excellent and quality health care. And hear me, when we start behaving like everybody else in the body of healthcare, this country is going to hurt, and it's going to be very sad. And again, to the fellow physicians here, until we make it about them, they're not going to make it about us. And this is not a witch hunt, truly. Corporatized healthcare, until they really believe that they're suffering as we check out and burn out, this probably is not going to turn around. But I think it's a good principle. It was probably 5 weeks ago. I was down the street at a hotel. This is part of my view, and I'm thinking, this is not Greensboro. This is really pretty. This is really a hustle and a bustle. But I was working on my healthcare talk. I was in the back of a hotel, and I got speaking to a fellow urologist at the meeting, Stephen, and Stephen shared a story with me because we got on this topic, and he said, you know, a professional colleague called him, a primary care doctor, just out of the blue, and he said, are you okay? He just thought, well, that's odd. And he said, what do you mean? He said, well, you know, I've sent you patients forever, for a long time, actually at a network, because you're just a phenomenal urologist. And he said, I've had 4 or 5, maybe even 6 people recently come back and say, you seem disengaged. You didn't seem interested. You were firm. You were actually a little bit abrupt. And I said, that's not him. I'm going to call him up. Are you okay? And we actually stood there sort of in silence. And his transparency and the silence, it just spoke so loudly, at least to me. You know, he just didn't realize how the pressure of medicine had affected him. And I can remember going to dinner that night, and I was kind of walking back from the crowd, and I go, man, I can't imagine how many dozens and dozens of patients have said that about me. It's sad, but it's true. Well, that leads to the next topic. It's physician burnout. I'm not sure how many Stevens are in this crowd or audience, or how many here might know Stevens, but this is an important topic. A couple of things. I'm not a burnout expert. I'm a urologist. But I'm in the trenches every day with each and every one of you. I really do have a heart for this concern for this issue, and I do struggle with it some myself. So maybe I'm a good person to be up here today trying to help. The second, I remember the LUGPA committee said, Scott, be granular. I had to look at what's granular. But they said, you better come up with some solutions. And I'm going, jumping. Anyways, I don't have the magic bullet. If there's a magic bullet, someone a lot smarter than me would have already figured this one out. But I'm hoping to share with you some solutions and survival tactics that will make a difference. If it makes a difference to a couple people in this room, or you can help someone else, for me, that was mission accomplished. You know, I read a book by Andy Andrews. It's called The Noticer, and actually I am a noticer, and most days that's good. Some days it's very painful, actually. But over the years, what I've noticed from my colleagues, they went from the Marines with shoulder straights with big smiles to disheartened, saddened, frustrated, angry. I get angry too much at work. They feel devalued and disrespected. You know why? Because we're devalued and disrespected. They're not having fun anymore. I used to have fun all the time, and I don't often now, unfortunately. And I do notice that I think there's urologists or doctors that are retiring, instead of looking back at their 30, 35 years and kind of being proud and say, look what I gave back to that community. Sure, I made a good income. They're actually saying, it's relief, it's over. And if I'm right, I think that's the saddest thing I could say, but I think the greatest profession ever bestowed upon man. What I've also noticed, some of them are colleagues of mine. There's a lot of urologists or doctors in their 50s and 60s, they're checked out. They're just trying to get to the finish line. If you understand the late stages of divorce, so when one of the partners, they're just checked out. They don't care what the other one's doing. And I do think there's a lot of doctors right now, they may be smiling to their patients, but they're just waiting to get, to retire. And that's not good for our country. Well, what I've noticed and spoke about and written about for a number of years, the professionals call burnout. It dates back to 1974 with Christina Maslow described it as a syndrome of emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. The first one is when you're so mentally and physically wiped, literally, you don't know if you can go back to work. You just don't know how long you can keep doing this. The depersonalization is when the patient becomes more of a number. There's just a means to the end. It's like, I got 4 more patients. It's not Mrs. Smith and how your family's doing and all that, and that's our joy. And also as part of that is when I said, darn it, I'm burnout too. It's when you're over cynical and when you're over sarcastic and when you over soapbox, you're part of this syndrome, and I'm the soapboxer in chief. Decreased sense of personal accomplishment, very sad, I don't suffer from that, is when you stop believing in what you do. You just don't see your purpose or the meaning of being a physician anymore. I think that'd be very sad. Now, I want to look at it a different way. I'm going to call it joy. I just thought medicine is a profession of joy, maybe like no other. And we had full joy tanks forever, didn't we? I mean, the first decade when I practiced, it was awesome. And I just find the system keeps taking from us and taking from us and taking from us. And we just keep refilling the tank and refilling the tank and refilling the tank. And at some point in time, somebody just can't keep refilling the tank. And the joy meter is running on low. And in some cases, it's running on empty. And that's a real problem for our great nation. The more I learned about burnout, it's a big problem. It's very common. We're actually doctors are twice the normal population. Urologists, very common. We were actually top of the charts one year in terms of physician burnout on a survey. It doesn't matter if you're a surgeon, primary care, if you're owned by a healthcare system, if you're a resident, if you're a LUGPA member, prevalent or incidence is about the same. I didn't realize how some people suffer so much from it. They're just suffering, and they're doing it in silence. They're embarrassed. They're being belittled by their partners. They're being pushed away from the healthcare system almost as if they were damaged goods. And, you know, there was 8,000 surgeons. This is general surgeons. You know, the Marines were surveyed, and 38% had symptoms of depression, and 6% in the year previous had thought about suicide. Are you kidding me? And you know that plane goes down, one of those goes down every year full of doctors. Yes, 300 to 400 doctors a year are killing themselves in suicide. That's just unacceptable, in my opinion, for what a wonderful profession. We have a problem. People ask me now and again, or I'll think to myself, they go, Scott, why do you think people are burnt out? And I just sort of laugh. You're kidding me, right? I mean, you're kidding me. Well, let me explain it to you. If you understand a doctor, their left brain, that's get the job done, be a perfectionist, drive excellence, just the buck stops with me. And you combine that with my right brain, one of love and compassion and caring. That's our love language. You take that human being and you take him from a profession that used to be 24/7 affirmation, respect, thank you, trust, and you put him in today's healthcare system, that's like sending a lamb to the slaughter. Are you kidding me? What a setup. And what I mean by that, and I'll try to keep my voice down, a healthcare system was really, I mean, you can argue every day, it seems like it's death by 1,000 cuts, whether it's your EMR, whether it's your next regulation, whether it's a pre-authorization. A healthcare system where we're like restaurant owners herding cats. We're trying to drive excellence with a healthcare team that cannot drive excellence. It's a healthcare system where the hospitals in many cases have sacrificed us for profit. And you know, many of us don't believe necessarily in what they believe, and many of us may not trust or respect them. That's a tough system to fight to not get burned out in. Also, a healthcare system that has just gutted us financially. I mean, just imagine the hardest working kids, just how hard we work, cannot afford their own private practice now and have been pushed into a very expensive healthcare system. Shame on you, Medicare. I mean, I really never believed it as a Canadian. And finally, I don't think many people will say this when they write about it. Maybe I'm not PC enough, but I think that last one is very important. The patients are killing us. And I really mean that. And, you know, I'm an American Canadian citizen, and I truly love America. I really do. And I can honestly say this. The loss of civility of our nation really gives me despair. I'm very concerned about it. You folks know what I'm referring to. But that loss of civility is in my waiting room and talking to my nurses on the phone every day. And I just think there's no place for that in medicine. And I really want to spend a moment on this because I try to figure out myself. When you disrupt or destroy the patient-physician relationship, what do we got? I mean, think about it. A relationship that used to be trust and thank you and respect and forgiveness, now commoditized to how much does it cost, and my happiness or satisfaction is on the outcome. I mean, honestly, you just put that knife right in my love language. You just tore up the right side of my right brain. That's why I'm doing this. If this is just going to be a left brain relationship, I might as well go to Wall Street or sell chip bags. This is not for me, okay? And so we really do have a problem. Anyways, let's move on. So, Houston, we have a problem, cost, quality, burnout. I'm an optimist. We're going to solve it. We're going to move forward. I'll share some survival tactics. And it's really, I want you to be thinking this. These survival tactics are for burnout, but it's to find joy. My goal in life is not that I don't have burnout. No, I don't know about anybody else here. I want to have joy in my job. I say to my wife, I just want to love going to work like I used to. I really want that. I don't know if anybody here, I think we all want that. And I do believe if we have a full or pretty full joy tank, we will have the fortitude and strength as a profession with like-minded other people to save this healthcare system, okay? But there's 3 important principles of this, and stick with me on this. For this to work, we physicians need to survive. The patients need us, the country needs us. We physicians need to be the voice. We've been sacrificed, but we got to be the voice. No one else is going to do it. No, there'll be no change without us. But we, the physicians, we need help. We're losing. We're not going to be able to do this unless some very powerful, like-minded people help us. Now, what the experts will say, and I'm not really going to spend much time on this, there's just so much written on this, and go online, and these are sort of the main 3 things they'll talk about. And what I noticed, though, I told my wife, Andrea, I go, I like kind of this stuff, but they want us just to fix us. Nobody seems to want to deal with the things that are obviously burning us out. It's really odd, actually. It was not odd, but it's interesting. Well, newsflash. Until you change the things that are beating us down, until you treat us differently, this problem is just going to get worse. And you can only stay in a bad marriage so long. And I love these people that are doing this, but going kayaking and me getting a massage this Saturday is not going to fix my burnout. Excuse me. Now, when I thought about this, and LUGPA said, get some solutions, I said to myself, it is. It's like a battle. It's like I want to get a theme, and I said it really is almost a daily battle, at least for myself. So utilizing a battle theme, we're going to talk about the battle, burnout, and find joy. Put on your suit of armor. You're going to fortify the homeland. You're going to make peace with the enemy, and we're going to call for reinforcements. So let's just go through that. Putting on your suit of armor is really having the internal strengths and the qualities of fortitude, so you can sort of take on the battle, that you have that strength as a person. I'm working on mine. We'll talk, there's so many of these, but I'll go through 5 quickly. The most important one, in my opinion, is what's your purpose? What's your why? What are you here on this earth to accomplish? And I do believe that healthcare providers were given gifts and talents to help others. I really believe that. I believe that we were given that left brain and right brain to serve. I'm not sure who here has ever listened to Rick Warren. He wrote The Purpose-Driven Life. But if not, I'd recommend it. His words are very life-giving. And what he'll often say is a life without a purpose is a life not worth living. And as I get older, I think about that a lot. And quite frankly, that may be why I'm up here today. And have you ever noticed, when it comes to serving, most people that serve in our communities have uniforms. This 3/4 length lab coat in the early 1900s was adopted by physicians from the laboratory, trying to give these physicians some scientific credibility who otherwise people thought were sort of a bunch of quacks giving potions and pills. And even to this day, this lab coat you're looked upon as a scientific healer. Well, to my fellow doctors in this room, this actually is your suit of armor. When you put this on every day, you look up or you look in, but you straighten your shoulders and you be proud of yourself. This is why you're different. You've been asked to serve. You've been asked to sacrifice. You've been asked to reach beyond yourself for others. And I actually believe that only best are given such a privilege. The second thing I would say to help find joy and to battle burnout is be a grateful person. This is something I really have. I think the reason I can be highly functional and really battle my tendency towards burnout is I'm really grateful. I am so grateful for my wife Andrea, my daughter Lindsay, and my little dog Maddie. I am so grateful for my friends back in Canada and this country. I really am. I am so grateful to be on my end of the stethoscope and not the other. And when I bow my head at night, I know why I'm grateful. But gratefulness brings joy. I highly recommend it. Third is I have a forgiving spirit when you go to work every day. Forgiveness will help you battle burnout and give joy. There's two men in this room. One's my administrator, one's my partner. They know I struggle with this. I get all in knots so easily at work. I'm just too emotional. But whether it's a rude patient or I think one of my partners may have dumped the patient on me, things aren't going my way, I can stew all day. And it's really destructive to the practice, my apologies, but it's really destructive to yourself when you're trying to fight burnout. You have to have a forgiving spirit. You forgive because it's the right thing to do, but it's so freeing to yourself, I highly recommend it. Fourth is Carpe Diem, seize the day. I really like that movie by Robin Williams, and I think, you could probably argue there's not many professions that allow you to seize the opportunity every day like medicine. And I'll just share a couple with you. Use each day to seize the opportunity to make a difference. I do this actually better when I'm on call. I'll paint the picture. It's 2 o'clock in the morning, I'm going in, I'm feeling sorry for myself, and I got to go, and I'm going into the room, and I say, Scott, you're going to help the urologic problem, but just humanize that person in there. Make them smile. Make them feel safe. Make them know that you got them covered. Make them feel like a person. And it really makes you feel joyful, and it really helps them. And maybe we could change the world helping one another that way. The second way to seize an opportunity is to become a better person as you get older. I do believe that we are tested in the areas of our weakness so we can become more patient, we can become more loving, more caring. I really believe that. And medicine, wow, what a testing ground. 30 patients a day and all those phone calls. It really is something. I'm a slow learner, but I'm getting there. Finally, you've got to be a man or woman of action. Soapboxing and just talking about it, you're not going to be able to fight burnout. You've got to act, and we'll talk about that momentarily. I'm going to also spend some time on this one, and then we'll move on quickly. If you're going to get joy and fight burnout, to my fellow LUGPA groups, you got to fortify the homeland. You got to build a moat. You just do, to just ward off the attack from all the external forces. And what I mean by that, you need a workplace that is so wonderful and joyful that you aspire to go to in the morning. You feel safe when you're there, and you feel fulfilled when you go home at night. And why I say that, the opposite is so destructive. If your perception of your LUGPA group is one of a death by 1,000 cuts, it's going to destroy you so much faster than all these external forces that you may be blaming elsewhere. So what does that look like? You folks know this well, but a fortified LUGPA group is led. It's led by a physician leader. It's not led by an administrator, not by groupthink, not by stumbling democracy. By an all-in leader who has the time, the energy, and the fortitude to sacrifice for others and to make tough decisions and to keep everyone accountable, including himself and herself, or herself. A fortified LUGPA group has a lofty vision. I believe that should be to drive patient-centric excellence. I believe it should be that everyone in this building is here to use their gifts and talents to help others. And when your staff buy into that and they believe what you believe, you're going to have a much joyful and happy clinic. A fortified homeland or LUGPA group is safe, and I'll spend some time on this one. I think one of the travesties of the American healthcare system, or tragedies, is the indoctrination of the culture of Wall Street and corporations into our hospitals, a culture of where you sacrifice your employees for multi-million-dollar profits and the fiduciary responsibility to the shareholder. And now in healthcare systems, it's showing multi-million-dollar spreadsheets and metrics to the board of directors, and administrators make millions. You know, what's happened is in healthcare systems now, the people doing the caring, the doctor, the patient, and the doctor, the nurse, and other providers are not being cared for. In fact, we're being sacrificed for profits. And what that looks like is apathy. It looks like mediocrity. It looks like every man for himself. It looks like lack of excellence. It looks like burnout. What it also looks like, unfortunately, is a patient sitting in urine or stool for an hour with their call light on. It looks like a catheter balloon being blown up in urethras every day. It looks like quality deteriorating as one hospital really didn't sign off the patient to another hospitalist. And it looks like medical errors or even accidental deaths, all in buildings that are making millions of dollars that have world-class care signs over them. And the reason I tell you that, my fellow LUGPA group, don't run your group that way. Unlike them, we're not too big to fail. Fortified homelands, this is very important. Empowerment. We are living in this culture. I even noticed this when I moved here 20-some years ago from Canada, but it's getting worse. This assembly line robotic mentality where people go to work and I'm not even sure they know what they're doing in a sense. They don't understand the importance. You have to empower your staff to make a decision. Empower your staff to use their gift to help others. They need to make that decision. And what you do, you make them very self-confident when you do that. And a self-confident employee will drive excellence and help you and help your patients, and they'll look out for their fellow employee next to them. It's not going to be every man for themselves. Finally, or a few other things. Fortified LUGPA groups, accountability. You can't have leadership without accountability. It's a ship without a rudder. Listen, you've got to listen to your partners, your young partners, your older partners. You can't keep telling them that that's just the way we've always done it around here. You can't, as these groups get bigger, you're at high risk of this, where there's a significant minority that don't like that decision, and it really can divide a group, and it really promotes burnout in even your financial livelihood. And finally, I don't really have a bone to pick on this, but I would recommend for you to reward your overproducers. I do believe some people just can produce more than others. And if you don't reward them, it can breed resentment. And if they regress to the mean, it can hurt you financially. And then finally, a fortified homeland acts and adapts. That's what you folks, you're famous for that. LUGPA, this is why you're here. You guys do everything. You just keep moving and you act and adapt. You say, Scott, what does that look like? And I'll just throw a few, I know this is getting a little bit lengthy, but throw a few things out there. You really want to decrease tasks, decrease exposure, and decrease the grind. One thing, in terms of tasks, I want to go back to Wake Forest 10 years ago. I want to go back in 10 years when I almost didn't have tasks. You know why? Because other people were making the decision that you approved. And what I would recommend is take each functional unit in your clinic, your nursing stations, your front desk, whatever, what have you, triage. But there's a captain. They run that clinic. They get a question or a task, they ask the captain. Captain answers it, or the captain also empowers and keeps people accountable. The captain doesn't know the answer, they come to you on a quiet time and get the answer and teaches the other. And you need your administrators in the trenches every day. They got to be running this, they got to, keeping the homeland fortified. They just do, we need them. The second thing about reduced exposure, just going through, get a scribe. Physician extenders, make sure they're driving your excellence, because otherwise the care they may be giving may be frustrating you. When your IT goes down, you better have someone there now. If you're talking to China or someplace overseas trying to save $5,000 a year, you're going to have a stroke, and you're wondering why you're burnt out. Just call me Canadian, but I have no idea why you folks why we're allowing patients to call us at 3 in the morning and say, my testicles have been sore for 2 months. I just don't get that. We're on call to the emergency room. We're not on call to talk to folks. I mean, be honest with you, in a perfect world we would be, but we're burning out. So make sure you're protected in a system that you're not answering the calls. Finally, reduce the grind. Some of us are not going to make it. Some of us are retiring way too early. We really don't want to. So we've got to start thinking differently about this. I believe most physicians could make 90% of their income and work 4 days a week. If you have to do it, do it. Write a check for $40,000 a year gross income. Don't take any more call weekends and reduce your call burden by 50% if that's what helps. LUGPA groups provide an exit strategy. It's not just for people like me in 3 years when I'll be 63, or 5 years when I'll be 63. It's for young people that are struggling as well. If they want a job share, if they need to be an office urologist, let them do that. And I say this, when all else fails, give them what they paid for. We are workaholics. And society has benefited from that. Fortunately, we're givers, but we're burning out. And as my friend David Staskin said, and he said it in jest, but he's so right, he says, Scott, when are you going to learn that the sweet spot of medicine is when an overperformer learns to underperform? It's actually sad but true. Go home. Go home and build your legacy at home. Go to a Hurricanes game with Lindsay. Put your Toronto jersey on Maddie and go for a walk with Andrea. And yes, we do have a dog stroller. Now, what about buffer the cost? You're going to say, Scott, you want me to slow down? Are you kidding me? And just a couple of things. What I mean by corporatize your schedule, if you've got 15 urologists and you get a 10% no fill rate on no-shows and inefficiencies, you've probably just lost $1 million. There'd be plenty of office urologists, let's say in their 60s, that would do a 1099 income at $1,000 a day, 2 or 3 days a week, and bring in a lot more money and drive a lot more excellence than a nurse practitioner that is being paid 40%. Think about it. If we have a group of 15 and they're taking 6, 8, 10 weeks off total a year with half days off and all that, you're probably leaving $2 million on the table. Bring in locum, start covering some of that, and use some of the money to help the burnout issue. So, stick with me, got a little bit left. So we've got our suit of armor, we've fortified the homeland. This is a long battle. Arguably, there won't be any winners, and we're going to have to sort of sit down and make peace with the enemy. The enemy in this case is the healthcare system, and do not take me out of context. They're truly not our enemy. This is a war theme. You get what I'm saying. Two important things. Well, first of all, we have to proactively redefine our relationship with them. We really do. We have to sit down and start over. We have to be very transparent, very honest, but we've got to get on the same side and do this together. And I say a couple of things. There's arguably no one else in corporatized healthcare that gets hurt more when we check out and burn out. I just don't get why they don't see that yet, or their consultants don't see that. There's also probably no other entity but them that could help us fight burnout, bring us true joy, and us with them save this healthcare system. And I really cry out to the administrators in this country, to the CEOs of healthcare systems. Those that are given so much, and they've been given so much, are really are giving so much responsibility. And their responsibility is healthcare to their community. Their responsibility is healthcare to your state. Their responsibility is healthcare for this country. I would love to be them. What a legacy opportunity. I really mean that. And I do believe, I do see brighter days where maybe people like us can convince them and look for more like-minded CEOs that are going to seize the day and seize those legacy moments and provide health care. They're going to do just well financially. Finally, I don't think we're going to win this without help. We need like-minded people. We're going to have to call for reinforcements. It's just the way it is, but we need to survive. You know, a few things. It's really difficult to strike and unionize as a doctor. It's not impossible, but you can unionize your voice without unionizing. And you can do that through social media. I'm not an expert on this, but just stick with me conceptually and tuck it away. If the profession of medicine, in a very professional, honest, not witch hunt way, exposed the truths about corporatized healthcare on social media, you would have a headline and change in behavior in a week, because these folks are spending tens and hundreds of millions of dollars branding untruths. What about and if you don't like them or not, if you don't realize the power of social media, it's probably how he won the presidency. I'll leave it at that. What about the power of LUGPA? You know, LUGPA, please, be a leader in burnout, but much more than that. Help us fill our joy tanks, really come up with ways that us urologists, and then we can tell our mates in general surgery and elsewhere, we want to have joy in our job. And I really think, we can call for reinforcements from you to help us with that. But the most important thing I say to LUGPA is, with all your your political connections, the congressmen, the people you know, please, I'm glad that you're fighting tort reform. I'm glad you're fighting reimbursement and coding, but try to find like-minded legislators that truly understand when the profession of medicine dies, the country dies, and truly understands, not in a bad way, but we've over-corporatized the American healthcare system, and it's not sustainable. A couple of years ago, I had my suit on actually. I'm standing across the street looking at this building, and I was trying to get on his healthcare team, and he wasn't answering my phone calls. I don't know why. But I had this FedEx box pinned against my chest. I had all my ideas and a TED Talk and all this stuff to give him. And I go, I can't go in there. I got sweat pouring off me, and I'm 55 or so at the time. And, I got to go. So I walk in, I introduce myself. I don't know what wood chipper my box ended up in, but I didn't get on his healthcare team. Now, I tell you that story for this reason, because even though I'm a realist, I do believe that we are one. We are just one politician, one like-minded wealthy person, one headline, really one documentary, one decision. If doctors said we're going to go on strike, it would really change things, and our country needs us to. If you ask me what is the one thing that would fix this, it's hard, but we need a healthcare movement. We really do. We need millions of like-minded people, grassroots efforts that we've had enough. We're done. We're going to change things. If we had such a movement, it would likely have to be at least partially led by physicians like us. If I was fortunate to be in such a movement, I would name it the name of that book I've been trying to write forever. I would name it Be Different, because healthcare matters, and it matters more than me. Because I see that as a solution to the problem. And until you deal with a solution, you're still going to have, until you deal with the problem, you're going to continue to have the problem. And millions of patients go to bed at night not having access to affordable health care. And in a great nation, I believe that's unacceptable. And until each and every one of us addresses our own greed virus, the best aren't going to go into health care. And in a great nation, I believe that's unacceptable. And until each and every one of us looks inside and says, I'm going to do something, I'm going to change my behavior. And let me restate it. I'm going to be different because healthcare matters and the health of this nation matters, and it matters more than me. We're going to continue to commoditize healthcare. We're going to sacrifice excellence for profits. And in a great nation, I believe that is unacceptable. So just to conclude, to my fellow physicians out there, remember, this is your suit of armor. This is why you're different. When you put this on every morning, you look up or you look in, but you straighten your shoulders and be proud of yourself. You've been asked to serve. You've been asked to sacrifice. You've been asked to reach beyond yourself for others. And I believe only the best are given that privilege. And to my friends perhaps here today from Medtronic, Astellas, all the wonderful companies, please be different. We need your help. To the CEO of Blue Cross, United Healthcare, other insurance companies, please be different. We need your help. To all the administrators back in North Carolina, across this country, please be different. We need your help. Look up or look in, but please be different. The patients need us. The profession of medicine needs us. The healthcare system needs us. And this nation I love needs us. Thank you very much. Cheers.